From worries about health insurance to affordable childcare, every family seems as though they're experiencing a tough time these days in one way or another. Well, there is an agency unique to St. Louis that is helping families find the resources they need to be successful when they need it the most. And we're going to introduce you to ARCHS on today's City Corner. Welcome to City Corner. I'm Ivy Hartman. Now, the ARCH here in St. Louis is a great icon, but joining me today is Wendell Kimbrough, the CEO for ARCHS, which stands for Area Resources for Community and Human Services. Wendell, welcome to the show.
Happy to be here, Ivy.
Typically, when you talk about a nonprofit organization, you're talking about providing services directly to your clients, but ARCHS helps in another way. Talk about that.
ARCHS is a very unique organization in that while we work very specifically with community-based organizations, or CBOs, we don't deliver the direct services. ARCHS is charged with making sure that you have the right organizations delivering the right services in order to get the biggest results you can possibly receive.
Now, ARCHS is part nonprofit, but also there is a for-profit side to this entity that helped make this happen.
There is a subsidiary, our financial services subsidiary, Leverage Resources Management, that provides financial services to our other nonprofits throughout Metro St. Louis in order to allow them to execute their mission while someone else is properly managing the finances for them.
Okay, how did ARCHS get started?
ARCHS is part of 21 community partnerships throughout the state of Missouri as a result of a 1995 execution of an executive order by former Governor Mel Carnahan. We are the largest of the 21 community partnerships, and we are all charged with helping bring together community-based organizations to deliver great services to the state of Missouri.
How were these community-based organizations selected to be part of ARCHS?
The community-based organizations that we work with typically are in the areas of education through pre-K programs, through K through 12 education programs, and adult programs. We work with the organizations based on that specific need for the community at that particular time, and then in particular instances like our After School for All partnerships, our ex-offender reentry programs, we target organizations that have a particular expertise.
So do you ever, you're partnering with existing programs now. Are there other programs out there that could contact you, or through the LRM program that could get assistance?
Absolutely,
okay.
Absolutely. For us, depending on the program, it's got to fit within our business model. It's got to be part of some sort of educational component that's working at that particular time, or a program that we're involved in at the time. But yes, we ask anyone to look on our website, it's STLARCHS.org, to take a look at how we deliver programs, why we're delivering a particular program in a particular community, and if they feel that they should be a part of it or could be a part of it, we always invite them to take a look at our RFPs.
So let's talk about a program that's going on right now,
okay,
affecting families throughout the state of Missouri, Mo Health Net.
Mo Health Net. Mo Health Net is our statewide program that allows underserved communities and underserved families to possibly be eligible for health benefits through the state of Missouri. It's part of the Medicaid system. It's a wonderful program that allows families who otherwise would not be able to afford health care for their children to be able to provide health care for kids.
So let's say you've got a child, is it school age or?
It's ages 3 through 19. I'm sorry, birth to 19.
Perfect. So it covers any of their medical needs, doctor's visits? Okay.
It's medical visits, dental visits,
oh, wow,
you name it. It covers everything.
Now there's a lot of requirements and prerequisites that need to be met. So if you think you might be eligible, the best way to find that out is to contact Mo Health Net directly.
Call Mo Health Net directly at 877 543-7669.
Perfect. You can also log on to dss.mo.gov/MHK. All right, now you talked about the mission being, serving lifelong learning and things. What are some of the other, we've mentioned after school program and the reentry program. What are some other services that ARCHS helps organizations provide?
Well, we are probably the largest manager of pre-K child care development centers in the metropolitan area, with over 80 child care centers that go through technical assistance support with ARCHS or professional development. Our belief being that both after-school programming as well as child care programming should be considered a profession. Therefore, we develop programs, or we're in concert with other organizations to create curriculums to enhance the quality of services delivered by the provider to the young people.
It seems like being an umbrella organization, there has to be a lot of fiscal responsibility and have a very concise and tight business model in order to make sure that the funds are going where they need to go, but also that the services are effective. How do you have an evaluation process for that stuff?
We have a very systematic evaluation process, but first let's go back to the financial component.
Okay.
The financial component, through LRM, our financial services organization, they allow us to assure any funder that there will be audits that will be executed properly from both a financial standpoint as well as a programmatic audit. I'm very proud to say that LRM has had the highest and best audit a not-for-profit organization could have for the last 7 years. It's one of the proud business points that I stand on and that ARCHS stands on when we're talking about delivering services. We will manage the financial components in a way that assures dollars are being executed the way they're supposed to be done. From a programmatic standpoint, we conduct our own RFP process through all the way through our monthly management system, which allows and assures us that through site visits, through technical assistance, through professional development, through consistent communication with the organizations that deliver the services, that we're on the right path or that we're delivering the services that we're promising. In those instances where you may not be delivering the services that you've promised, then we have a correction process that allows us to help you enhance yourself as a deliverer of services, or in those very rare cases, sometimes an organization is asked to no longer be a part of it because we promised funders, we promised the state, we promised the feds that if we're delivering a product, that it's going to be a quality product and that provider must deliver it the way it's been dictated to us. And as an oversight organization and a community partnership charged with bringing partners together, if that partner's not working, that partner can't be a part of it. Fortunately for us, we have over 350 partners, and I'd like to think that 98 to 99% of those partners deliver what they promise.
That is a huge conglomerate of organizations. We're going to address some of those organizations. There's over 20 of those partners working together for the reentry program. And when we come back, we'll talk more about this one-of-a-kind, highly successful reentry program for newly released federal and state prisoners. Stay right here.